Hi there, my name is Anna Johnson, and today we will be discussing Three Mountains Regional Hospital Intake Packet and everything that entails in the intake packet. Here we go. So, the overview of our ethics and values of the hospital. The mission of Three Mountains Regional Hospital has always been to focus on health through education, community, clinical practice, research, and being able to provide each patient the best care every time they step through the door. Our ethics and values embodies our values and sets a foundation for our responsibilities and behaviors that help us make the best decisions for this hospital, for ourselves, and for the community we serve. Several common values, orientations, and ethical principles we are proud to incorporate into this hospital include beneficence, non-maleficence, justice, respect for patient anatomy, and confidentiality. The following are our core principles of ethical conduct that represent our values that support and help serve our mission. The first one is we prioritize the health and well-being of our patients and consumers. This means always practice respect for all persons, like treating those we treat and whom we work with and the public we deal with, and treat them in the same degree of respect that you would wish them to show you. We also like to treat the patients and colleagues with kindness and dignity. We fully include patients' wishes for treatment in the plan of care. We respect the privacy of patients, and we do not discriminate based on gender, religion, race, disability, age, sexual orientation, national origin, or material status. The second important code of ethics that we have is we produce and deliver safe, effective products that people can trust. Not permitted to directly or indirectly provide anything that benefits a government, producing and delivering safe, effective products and services people can trust by committing to identifying, evaluating, and addressing safety issues. The third one is we actively oppose fraud, bribery, and corruption. This means the hospital is not permitted to directly or indirectly provide anything that benefits a government official, a healthcare professional, or any other persons in order to secure a sale or create an advantage for Three Mountains Regional. Our fourth ethic here is we adhere to all laws, regulations, and requirements that apply to our work. So this could mean conducting all business operations within a manner of complying with laws and regulations that are trusted and respected to those we serve. We address and resolve any conflicts of interest before moving forward. This means each employee is expected to use good judgment and avoid any situations that would lead to conflict. The sixth one that we have here is we value our diverse perspectives as a source of strength. That means not sharing medical or personal details of patient with anyone except those healthcare professionals, or not seeking data on patients unless you're a professional and need to know. The seventh one here is we respect and safeguard confidential information, including personal information, like fostering a culture of openness and being able to recognize the diversity throughout, and that it drives collaboration drives innovation. It also promotes an atmosphere where people can voice their concern without retaliation. So what is the purpose of the intake packet? Well, for starters, the intake package should be utilized as a resource for patients to understand Three Mountains Regional Hospital's ethical and legal application towards our healthcare practice. It can also be used to understand or stand on legal and ethical implications for individuals and populations. Our legal requirements for managing a patient's medical information, documentation, the release of information, and how the hospital utilizes the electronic health record system, which can also be found throughout this packet. The purpose of our code of ethics. Providing a code of ethics is to provide a guidance and set common ethical standards to promote consistency in behavior across all levels of employment. A code governs the actions and working relationships of board members and top management with employees and in dealings with other stakeholders. The purpose is to focus on health through education, community, clinical practice, research, and being able to provide each patient the best care every time they step through the door. Now, the purpose of a living will and advanced care directive, which is also involved in the intake packet. A living will is a subpart of an advanced care directive, which is supposed to help in guiding the families and friends to respect a patient's end-of-life final wishes on their medical care. The importance of a living will is that it lays out the ordinary or extraordinary care that you, the patient, wants or does not want. This document communicates the medical care you wish to have when you are unable to communicate your decisions, and it has no power after death. For a living will to be valid, it must meet state requirements where it regards witnesses. And this living will take effect as soon as it is signed. The person in charge is the agent or attorney in fact. After the death of you or another individual, the document dies as well, except for the power of the agent to make decisions about organ donation or possible autopsy. While filling out this will, one must think about the values and to help consider how important it is to be independent and self-reliant. Our privacy policy. Three Mountains Regional is committed to collecting appropriate patients' personal health information, which is part of our day-to-day operations. Protecting the privacy and confidentiality of a patient's personal information is important to all the staff here at Three Mountains Regional. We pride ourselves with accountability and our commitment to securing patient and privacy. Each physician and employee is responsible for the personal information under his or her control. Each and every employee is informed on how important privacy is and are periodically informed by our privacy policy and related issues. Three Mountains Regional understands you have every right to your health information. For most cases, your consent is implied as a result of your consent to treatment and is usually written. With regards to limiting collection, we collect fair information by fair and lawful means and collect only what is necessary for purposes related to your medical care. Three Mountains also limits the use, the disclosure, and the retention of your private information, which means we will seek your consent before using any of your information for purposes beyond the scope of the privacy statement, and under no circumstances do we sell patient information to third parties. We retain your information only for the time it is required for the purposes we describe. We also pride ourselves in accuracy, where we ensure all decisions involving your information are based upon accurate and timely information. Our hospital has safeguards which protects your information, and our computerized systems have password-secured authorization. Patients' privacy is so important to us, and being open and keeping you informed is our duty. If you have any questions or concerns about the privacy you have, we invite you to contact us by phone, email, or contact our health services manager directly. Now, what is HIPAA? HIPAA is an acronym for Health Insurance Portability and Accountability Act of 1996. HIPAA provides you as patients data privacy and security provisions for safeguarding your medical information. The first law emerged on August 21, 1996 that proliferates data breaches caused by cyber attacks and ransomware attacks on health insurers and providers, such as ours. Essentially, it was designed to provide privacy standards to protect you as patients' medical records and other health information provided by health plans, doctors, hospitals, and other healthcare providers. Now, what are HIPAA's purposes? Well, HIPAA's purposes can be simply put like this. One of the main purposes is to introduce several new standards that were intended to improve efficiency in the healthcare industry, requiring healthcare organizations to adopt the standards to reduce the paperwork burden. Code sets had to be used along with patient identifiers, which helped pave the way for the efficient transfer of healthcare data between healthcare organizations, insurance, and streamlining eligibility checks, billing, payments, and other healthcare operations. The second purpose is to prohibit the tax deduction of interest on life insurance loans, enforces group health insurance requirements, and standardizes the amount that may be saved in a pre-tax medical savings account. Thirdly, it continues to ensure employers and employees to receive health insurance coverage when they were between jobs. The legislation also required healthcare organizations to implement controls to secure patient data to prevent healthcare fraud. So let's simply put the HIPAA's goals like this. In summary, it improves efficiency in the healthcare industry. It is to improve the portability of health insurance. It's to protect the privacy of patients and health plan members, and is to ensure health information is kept secure and patients are notified of breaches of their health data. So why should you, the patient, Why should you acknowledge the intake packet and sign the form? Well, Three Mountains Regional Hospital understands how important medical information to patients and is a commitment to protecting the privacy of your information. As a patient here at the hospital, the care and the treatment you receive is recorded in a medical record. This is done to best meet your medical needs. We may share medical records with all healthcare providers involved in your care. With that being said, understanding the documents in this packet is crucial for you as a patient. It allows you the knowledge of the options you have within your Advanced Care Directive and Living Will to document your end-of-life wishes. This packet also allows you to make your best judgment based off our code of ethics to decide if this is the right hospital for you to attend. This packet was designed for you, the patient, in mind. Not only do you build the knowledge of your privacy rights, like the HIPAA and confidentiality, but you give our hospital the opportunity to provide you with the best medical care if we have access to your medical information at real time. Thank you so much for watching. If you have any further questions, please feel free to email me or reach out to your health services manager. Thank you. Bye-bye.